Are you a doctor? Did you go to medical school? I'm a nurse, so I know better than you when it comes to the pro-life issue or when it comes to abortion. Abortion is medically necessary. Abortion is health care. Okay. No, I'm not a doctor. No, I don't have a medical background. But even if I said the same thing that a doctor was going to say, I get this kind of pushback. How do you know? You weren't educated. You didn't go to medical school. So I'm going to have a doctor on the show today. And we're going to talk about this from a medical perspective and a science perspective so that we can once and for all debunk these people, despite the fact that I don't have doctor behind my name. Welcome back to Speak Out with Christine Jurgen. I know that was a little bit sarcastic, but it gets so frustrating that I can say the exact same thing that a doctor says, and you can educate yourself in some of the same ways. You don't necessarily have to go to school if you want to be in a practice, sure, but to know some of these same things. And you can learn from doctors, but hey, I don't have the degree, so we're going to have somebody on who does have the degree and listen to these credentials. We have Dr. Ingrid Skop coming on today, and she's the Vice President and Director of Medical Affairs for Charlotte Lozier Institute, leveraging more than 30 years experience as a practicing OB-GYN to support research and policies that respect the dignity of every human life. Dr. Skop received her Bachelor of Science in Physiology from Oklahoma State University and her medical doctorate from Washington University School of Medicine. She completed her residency in this word is so frustrating to me, obstetrics and gynecology at the University of Texas Health Science Center at San Antonio. She is a fellow of the American College of Obstetricians and Gynecologists, where she uses science and statistics to counter pro-abortion agendas and is a lifetime member of the American Association of Pro-Life Obstetricians and Gynecologists. I just like saying OB-GYN better. Prior to joining Charlotte Lozier Institute, Dr. Skop served for over 25 years in a private practice in San Antonio, where she delivered more than 5,000 babies and personally cared for women who had been harmed physically and emotionally from complications due to abortion. She has served as a board member and medical director for pregnancy resource centers in San Antonio, Austin, and Houston. Dr. Skop's research on maternal mortality, abortion, and women's health has been published in multiple peer-reviewed journals. Additionally, she has provided expert testimony at both the state and federal levels on legislation related to abortion, including standing firm against prominent pro-abortion politicians who choose not to follow the science regarding fetal heartbeat and development. So no, I don't have a medical degree, but Dr. Skop does. Dr. Skop, thank you so much for joining Speak Out. It is a pleasure to have you. I know that I could say the exact same things that you say that I've learned from you or learned from other pro-life OB-GYNs, but because I don't have doctor on my name, nobody is going to take what I say seriously. So here you are, I have you on, so we can listen to your expertise and you can educate us on a lot of things. Thank you for joining the show.
Thanks, Christine. I'm honored to be with you today.
So let's start out because I'm really interested in this life of the mother thing. This is what we're hearing right now because pro-life laws have been enacted in a lot of states, especially since Roe being overturned. And this is the kind of the pushback and the headlines that we're seeing a lot of is, you know, pro-life laws are doing this or they're causing harm to women or doctors aren't able to save lives because of pro-life laws. And we know that that's not necessarily true. So before we dive into all of that and you kind of explain things from an actual medical perspective, can you define for us what abortion actually is?
So the legal definition of an induced abortion is an action that is taken to end with the intent of ending the unborn human's life. And so right away, that's going to take a lot of the interventions that doctors may need to do out of the equation, because when we do need to intervene in a pregnancy, our intent is never to end that baby's life.
So when it comes to this, because I know that people have a lot of confusion as far as the different types of procedures that women have, maybe somebody's having an ectopic pregnancy or something along those lines. Medically, just because something is coded as an abortion, it's important to distinguish that there's induced abortions and then what a miscarriage would be classified as what, a spontaneous abortion?
Right. So that's an area where it does become confusing because medically, an abortion is any pregnancy loss in the first half of pregnancy. We call a spontaneous abortion the layman's term is a miscarriage, that's a natural loss. Nobody did anything with the intent of ending that life. The life just ended tragically. Induced abortion is where an external action is taken to end that life. It's what we colloquially know as an abortion, but more specifically, it's an induced abortion. But of course, what we're seeing is the abortion industry are trying to confuse people. I mean, really, because more than 95% of abortions are done for social or financial reasons, it's very difficult to say it's appropriate to end human life for reasons such as those. So what they're doing is pointing at the extraordinarily rare circumstances where the pregnancy needs to end in order to protect the mother's life.
Yeah, I wanted to make that because I think that a lot of people say, well, I had a miscarriage and I had an abortion, so we need abortion in this instance. But just because they're coded maybe the same for insurance purposes doesn't mean it actually is the same thing. The procedure might be the same, but in the beginning, one baby is still living and one baby has already naturally passed. So that needs to be distinguished, I think, first and foremost. And as a pro-life OB-GYN, or just an OB-GYN in general, I don't think that you necessarily even have to be pro-life. Do you consider yourself to have two patients when you are seeing these women who are pregnant?
Yeah, absolutely. And I think it is important to recognize that putting the politics aside, putting the abortion ideologues aside, for most OB-GYNs, abortion is not a part of our active practice. Approximately 90% of obstetricians will not perform an abortion if requested by a patient. So whether or not we may identify as pro-life or pro-choice, the reality is we are not actively ending human life in our practices. I think we probably all recognize that abortion really is outside of mainstream medicine. Planned Parenthood and other organizations that do nothing but provide abortions, they're not really part of mainstream medicine. Unfortunately, many of the medical organizations are ideologically pro-abortion, and you'll hear them say things that are very incorrect and misleading, like abortion is evidence-based health care, abortion is necessary medical care, and that is absolutely false. But they think if they say it enough, that somehow we'll all begin to believe it.
Yeah. So, and a lot of it is based on emotions, right? I mean, we all, for the most part, care about women. We want them to be healthy. We want them to have successful pregnancies and not have complications. We want their babies to be born unharmed and healthy. Like, these are all things that we want. And when you pull on those emotions and say, maybe a baby has a fetal anomaly, or the woman's blood pressure is skyrocketing and there's an issue and she might not live, like, that really pulls on your heartstrings. So it's very easy, I think, to kind of confuse people. Why do you think that most of the medical associations are pro-abortion? Like, where does the lopsidedness come in? Is this Planned Parenthood in their pockets? Is this, like, how does this even happen? If the majority of OB-GYNs don't want to perform abortions, how is there such a lopsided argument on this?
Yeah, I've spent a lot of time trying to understand that. And if you look back at the history of the legalization of abortion in the early 1970s, what you discover, actually even prior to that time, you see that medical organizations many times had a eugenic motivation. And we see this going all the way back to the Supreme Court Buck versus Bell and in the 1920s, 1930s, that there were many people who felt that there were certain ethnic groups or minority groups that should not be having children, that there were certain characteristics in people. For example, a mother who may, have an intellectual disability, that they should not be having children. At that time, there was a population control motivation as well. Unfortunately, we still see some of those motivations today, right, even though the issue of population has gone full circle. We now have a total fertility rate of 1.6, where 2.1 is reproducing ourselves. So we're not even reproducing ourselves in this country and most other countries around the world, and yet there's still those type of motivations. Currently in obstetrics, there is a strong push to do prenatal diagnostic testing to identify babies who are less than perfect, and then to offer and sometimes promote abortion to those mothers as a solution to the disability that their child may have.
So what does the future look like if the reproduction rate is, you said 1.6 and it needs to be 2.1? I mean, what happens if we stay at this rate?
Well, 1.6 means then that's a couple. So that's a man and a woman that they need to, I mean, it makes sense. They need to have at least 2 children to reproduce themselves. Sure. So we're having less babies than that. You know, we see to some extent, this can be alleviated by bringing people into the country to do the work. But ultimately, I think if we look at Japan, it's very educational to see what happens. You end up with a lot of older people. You have very few young people working, paying into the social support net to care for the people who are retired. And it's a demographic failure, really. It harms the economy. It harms the country itself because it can't support the older people. And then you see these countries start to address really difficult issues like, what do we do with those people at the end of life that we don't have the money and the resources to care for? You see families imploding, right? You don't have the younger people caring for the older people as much. So it's a complex topic. Maybe we could talk, I'm sure we could talk more about it later, but the point is we do need to reproduce ourselves. The point is pregnancy is the only way that we can bring new human life into the world. It's a good thing. A baby is a wonderful, miraculous human being, and yet somehow the narrative has flipped so that the baby is never even considered by many of these abortion ideologues. The narrative then becomes a woman is pregnant. Her pregnancy could potentially be dangerous for her. Therefore, we need to offer her abortion as a way to prevent maybe a medical problem later, completely negating the human life that we're ending in order to presumably protect a woman's life. But it's so extraordinarily rare for that intervention to need to be performed in the first place. Just a couple of things. You mentioned ectopic pregnancy. Every obstetrician, no matter how pro-life or pro-choice, have always intervened for an ectopic pregnancy. This is a pregnancy that cannot become a viable baby. At some point it will miscarry, but in the meantime, it may cause the fallopian tube to stretch, to rupture, to cause catastrophic internal hemorrhage, and many women have died from ruptured ectopic. So it's never been controversial to treat an ectopic. Of course, every doctor will treat a miscarriage because, as we discussed earlier, that's not an abortion because the life has already ended. And many times the times where a pregnancy complication does threaten a woman's life usually happens after the baby can survive. So what we need to do in that situation, we need to separate sometimes a mother from her unborn child. And almost all of the time we can do that through an induced delivery. And then we can bring in the neonatologist, and most of the time the baby can be saved. So we're not having to choose to end that unborn life. In the 30 years that I've practiced and the 5,000 plus babies that I've delivered, I'd never needed to do an abortion in order to protect a mom. Sometimes I have needed to deliver a baby, and tragically, sometimes he's too young or too sick to survive. But that's not even an abortion as legally defined. That's me intervening to protect a mom, and sometimes, tragically, the baby can't survive. But every doctor, pro-life or pro-choice, has always been willing to do that intervention.
So let's talk about, kind of dive into that, because what we see on headlines is pro-life laws prevent ectopic pregnancy treatment. Is that true?
Absolutely not. In fact, if you open up the laws, almost every law specifically says this does not apply to an ectopic pregnancy. So they're just flat out lying about that.
And then when it comes to a miscarriage, we see the same. Miscarriage treatment not allowed because of pro-life laws.
Specifically
True
say
or false?
This does not apply. Yeah.
Yeah, I mean, the point is to cause mass confusion, right? I mean, that's the only way that they can. I've always said this is, are you on the right side when you have to lie or cause confusion to someone and you can't tell the truth in order to get your point across and make people believe you? Because like you said, if you open the law, you see that there are exceptions. Now, when it comes to some of these exceptions, I'm curious, because pro-life laws do have life of the mother in a lot of them. And I understand there's an aspect of, we can't educate everybody on everything. So we put that in there to maybe get a law passed. But as a pro-life OB-GYN who said that you've never had a situation with 5,000 babies delivered where you need an abortion to actually save the life of the mother, is abortion ever medically necessary?
Well, going back to these laws, every single one of the state laws that is limiting abortion to protect unborn life allows an exception if an abortion is necessary to save the life of the mother or to protect the life of the mother. So, what we've seen, again, is intentional confusion, attempts to fearmonger and to turn the American public against these laws, to turn pregnant women against the laws, and to turn doctors against the laws. But we've looked at every law. We know that they all have an exception. It's usually worded, a doctor may use his reasonable or his good faith medical judgment to determine when to intervene in a emergency in pregnancy or a pregnancy complication that poses a threat to a mother's life. And some of them even go further and say a substantial risk of impairment to a major bodily function. Well, that all means the same. Of course, every doctor knows what conditions can lead to a risk to a pregnant woman's life. It's very clearly defined in the obstetric literature. None of the laws say that the risk needs to be immediate. But I think what we've all noted in the mainstream media is that there are doctors saying, I could not intervene until she was dying. This is a doctor who has not read the law and is unreasonably frightened that they're going to be punished. And the reason that they're frightened is because pro-abortion media have told them that they should be frightened. And sadly, as I mentioned earlier, so many of the medical organizations are pro-abortion. What normally happens in medicine when a law is passed that affects our practice of medicine is that our professional organizations help us with that law. They explain the law to us. They consult attorneys if needed and say, here's how you follow this law. And then we feel supported. There's a checklist. Okay, if we do this, if we do this, if we do this, then we are following the law. And our professional organization said this is how to follow the law. So if someone should point a finger at us, we can say, well, we're just following what the Texas Medical Association or whoever the organization was said. But what has happened in the wake of Dobbs is that almost no medical organizations have given any guidance. And I think that is ideological. I think that is because, again, they're hoping to confuse doctors and possibly see harm happen that they can then point and try to blame the law rather than blame the fact, the correct fact that sometimes doctors aren't intervening as quickly as they would because they don't understand the law. So that's where we are today. But to get back to your initial question about whether abortion is ever medically necessary, again, I've never encountered the situation in my practice. I would be hesitant to say it is never medically necessary because perhaps there's a situation where that was really the only option. But even if it is considered medically necessary by a doctor in his good faith medical judgment, every state in our country allows that intervention. So the confusion is unnecessary. We can see why it's being fomented because it's just an attempt to turn people against these laws.
Right. It's interesting to me because the difference between saving the life of the mother and an actual abortion is in both cases, you're going to remove the baby potentially if she has a life-threatening illness or something that's affecting her. All an abortion does is kills the baby prior to removing them. In the other instance, you just remove the baby. So let's talk about that. What happens if the baby is maybe too young to survive? Maybe it's 17 weeks or something along those lines. You do have to remove it. You don't kill it first, but that's what an abortion is, but you can still save the mother in this way. And unfortunately, medicine hasn't gotten to the point where we can save a baby that young. Hopefully one day it will get there. And we see that, that getting younger and younger gestational age where we're saving babies. What is the proper way to handle a situation like that? For instance, we know that abortionists, when they do it, sometimes will throw the baby in a bucket and it drowns, or it's just left to die. If a baby is aborted and then actually alive when it comes out, we hear these horrific things. What is the compassionate thing to do in an instance where the baby is too young?
Yeah, so I'll use the example of previable premature rupture of membranes, because this is the situation that we're seeing pointed to most frequently in our country and where I've seen the most confusion among my obstetric peers. So today, with the amazing technology that neonatal intensive care units have, we can often save babies born as early as 22 or 23 weeks out of a 40-week gestation. So that is amazing. Again, most of these babies can be saved, and we should certainly try to save their life if at all possible. So like you said, we need to separate the baby and the mother in a severe complication, but we don't intentionally kill a baby. We deliver the baby, and then we say, can this baby be saved? What has happened with PPROM? There's the ACOG, our professional organization, the American College of Obstetrics and Gynecologists, has told us in a practice bulletin guideline, there are 3 options when this occurs. So the water bag has broken, but the woman is not in labor, right? So what do we do in this situation? What we know is that the risk of the mother developing an infection is high. And we also know that the risk that the baby can live to an age where he can be saved, sadly, is very low. So it becomes a situation where we're looking at a high risk to mom, not much likelihood of benefit to a baby. So we can offer immediate induction. ACOG also says we can offer immediate abortion, or many women that I've cared for in this situation, if they're not actually infected at the time they present, they would like to try to stay pregnant in hopes that they can get their baby to a time that he can be saved. So again, one thing of the equation that we're not discussing, the pro-abortion media don't want you to know, is that almost all of these moms want their baby desperately. Women are willing to take a risk in order to give their baby a chance. So all of those things can be offered. If a woman is obviously infected, then we don't wait. Everybody knows you need to go ahead and deliver. But again, the delivery is induction and then see what we can do. Even in the situations where the baby perhaps does not survive the delivery or dies soon after, his family can hold him. They can show him love. We bring on perinatal palliative care, which is a multidisciplinary effort at the hospital, a chaplain, the neonatologist, various specialties, beautiful caring nurses to just be with that woman and with that family to show respect for that life, even if it is likely that the child is going to die. And moms do well with that. It's tragic. Of course, no one wants to go through that, but they're able to show the respect and the dignity to the life of their baby. So let's compare that to a dilation and evacuation. The layman's term is dismemberment abortion. After the first trimester, 95% of the abortions in our country are done with this procedure. So that is going in and is disarticulating and dismembering that live baby. So you can imagine, if no mother that I've ever seen that procedure explained to has opted to have her baby delivered that way. I mean, it makes sense. Of course, she does not want her baby to suffer and to be dismembered in order to protect her life. So again, in my practice, I've never had a mom who said, please let me have a D&E as opposed to an induction. But, we do recognize that there are some very pro-abortion doctors that are putting this out as the procedure that they think should be offered in this situation. But again, the state laws do not prohibit that if that's what the doctor feels is needed. And what the woman, she needs to agree with the doctor, right? So if the woman wants that, if the doctor wants that, no state law prohibits it.
So when it comes to perinatal palliative care that you're just referencing, as opposed to dismembering a baby in the womb, you do this palliative care. Does a baby suffer with that, or is the baby made comfortable and allowed to die with or pass with dignity?
Right. So absolutely, just as we think about hospice care or palliative care at the end of life, it's exactly the same caring approach. We don't want to see suffering. So if a baby appears to be suffering, gasping for breath or something like that, we can give pain control. So again, we're going to do what we can to minimize suffering in that baby. But we've seen too many women who've been offered this false choice. And I've seen women who've said, I chose an abortion because it was the compassionate choice for my baby. And to me, what that's telling me is those women, it has not been explained to them what is going to be done to their baby. You mentioned earlier induction as an abortion technique where the baby is thrown into a bucket to die. Again, if an induction is done in this situation, that baby will be evaluated when he comes out. Can he be saved? Regardless, he will not be treated with disrespect as an abortion would do, but he's going to be cared for as long as his life may last.
So let's talk about maternal mortality, because that's something that we hear a lot of these days as well. Mainstream medicine, I guess I'll call it. Mainstream medicine tells us that abortion is 14 times safer than childbirth. Is that true?
No, it's absolutely not true. But we're seeing these myths being recycled. So I think it is important for people to be able to educate themselves. It's an extraordinarily complex issue. So I will say up front that I've written a lot about it on our website, loserinstitute.org. We've got probably 6 or 7 papers in our On Women's Health section that deal with this. And that myth that you just mentioned, we deal with it directly. In a nutshell, the data regarding abortion-related deaths that the CDC collects in our country is known to be dramatically incomplete. Even the data that they collect regarding deaths related to childbirth is known to be missing at least half of the deaths. So from the beginning, we're not able to detect all of the events that lead to death. Once one has been identified, though, as potentially related to pregnancy, and I would say that a death of a woman that occurs anytime in pregnancy, at the time of the end of the pregnancy, or even up until a year after the pregnancy ends, is considered to be a potential maternal death. So we can see that there might be various different things going on in each of those situations. Early in pregnancy, as I mentioned, an ectopic pregnancy rupturing is a very common cause of a death. Deaths at the time of delivery, hemorrhage, sepsis, blood clots, a hypertensive crisis. The good news about that is that we are doing a much, much better job at preventing those deaths. Every hospital has protocols and toolkits that doctors can follow, and they tend to do drills where they help doctors and the nursing staff go through what do we do in these type of emergencies. So actually what we're seeing is those deaths are becoming fewer and fewer, which is good news because unfortunately so many women, because of this fear-mongering, have come to believe that there's a high likelihood that they're going to die at the time of delivery. And the reality is we're talking maybe 100, maybe 150 at max in our entire country. So they're just extraordinarily rare for a woman to die during childbirth. But what we're discovering is that more and more than half of the deaths are occurring between a week and a year after the end of the pregnancy. And increasingly, those are being attributed to mental health complications. What we do know about abortion, based on high quality data in Scandinavian countries, is that a woman is 6 times as likely to die a mental health death, suicide, substance abuse, opioid overdose, accident from high risk taking in the year following an abortion than if she had given birth to her child. So we know that giving birth protects women, and we know that having an abortion actually increases their risk dramatically of a mental health death. But our CDC does not have a system in place at all to detect those abortion-related deaths. So, going back to that statement, 14 times safer than childbirth, they're comparing the dramatically undercounted deaths related to abortion and comparing them to all maternal deaths, which, by the way, includes abortion-related deaths. And there's a lot of problems with the denominators. We don't even know, for example, how many pregnancies occur in our country. So none of those statistics are looking at all pregnancy events. They're only looking at the births that occur in the second half of pregnancy. So anyway, it's very complicated, as you can tell. But the reality is, when we look at better quality studies from countries who can look at all pregnancy outcomes and all deaths, we see that consistently a woman is much more likely to be alive a year after she has given birth than if she had an abortion, because there's a lot of deaths that occur in those women.
What a bummer that we live in a country that's not willing to give us quality studies and in-depth, thorough information and data to like base opinions off of. It's so skewed in order to, I don't know any other reason other than to promote a narrative. Like, we have the ability to do the same thing that these other countries are doing. And obviously you're sharing how this, 14 times safer is completely flawed and completely skewed. But would you say that the answer to any more maternal mortality would be abortion or better medical care? Like, why don't we just make medical care better? You don't just say, we have possibility of poor medicine and maternal mortality, let's kill the baby. I mean, we can make medicine better, right?
Right. You're hitting the nail on the head. I mean, what a simplistic dystopian solution to say, you might be at risk, so therefore let's kill your baby.
Right.
The reality is, again, we are doing a much better job of caring for moms. Maternal fetal medicine is a subspecialty that is all about making sure that women and their babies stay healthy throughout a pregnancy. So we should never offer abortion as a solution to this complex problem of maternal mortality. But there are reasons that we see, or subclasses of women that we see at high risk. Those that are in poverty, those that are single moms. Many women in our country have chronic health conditions: obesity, hypertension, diabetes, thromboembolic disease. So yes, let's address all of those issues. Let's try to help women be as healthy as possible. Another big factor is that we have a lot of women having babies at very advanced age. The narrative that women can go to school as long as they want, that they can start their career, they can spend as much time on their career, and then at age 40 or 45, if they're ready to have a baby at that time, that they can easily have a baby, needs to be exposed. Yes, many women do have babies at that age, but it is very, very difficult. They have difficulty getting pregnant. They need high-risk care. And the CDC data tells us that a woman who has a baby beyond the age of 45, her maternal mortality is at least triple that of a younger woman. So we need to be discussing all of these issues and really trying to do a deep dive into why do women die in relationship to pregnancy. But offering abortion as a solution is lazy, it's deceptive, and it's not true. And sadly, the group that has the highest maternal mortality in our country is Black women.
I was just going to ask you about that.
They also have an abortion rate that is 3 times that of white women. If abortion were protective, we would see a difference, but we do not see that difference. So I think what we can acknowledge is that abortion is not protecting them, and quite probably it is increasing their risk through a variety of factors.
That's such an interesting point that you bring up. I've genuinely never thought about it that way. They have a higher rate of abortion, and if abortion was actually protective, we would see that in maternal mortality rates within the Black community or within the Black groups that we're seeing. The maternal mortality rate is higher. But I think you also mentioned something, that there are conditions that maybe certain minorities can have. I've seen you say this before, where that can also contribute to it, but also abortion is contributed or counted in what you just said earlier. I'm kind of putting pieces together. Abortion is counted in maternal deaths. So
So
it kind of is
they're
like
being counted in both numerators.
yeah, it doesn't even make any sense.
Right. And the other things, like you said, genetic factors. Unfortunately, that population does have a higher risk of hypertension, diabetes, some other things that put them at risk. Unfortunately, almost 70% of Black women are single moms when they give birth. So living as a single mother is associated with poverty, and then poverty is associated with all of those risk factors as well. So, I'm not going to say I know the answer, but I'm going to say if we care about that population, we need to dig deeper. It's very eugenic to tell them you need to end the life of your children in order to protect yourself from maternal mortality. And it's untrue. We can do a better job at protecting these women if we're willing to look at the real risk factors. I mentioned again, mental health disorders after abortion, not just in this population, but in all populations of women. But we do see certain risk factors that put them at higher risk. And those risk factors include those who are coerced into abortion. And, that's another topic entirely. But we recently published a study that demonstrated that 60% of women with a history of abortion, there had been factors, either people in their lives or circumstances in their lives, that coerced them or prompted them to choose an abortion when, in fact, they really wanted to give birth to their child. Later abortions in our country, 10% of abortions occur after the first trimester. 1%, believe it or not, occur after the baby can survive separated from his mother. And 90% of those late abortions are not for life of the mother. They're not for fetal anomalies. They're for the same social and financial reasons that we see earlier abortions. And then multiple abortions, we also see increased risk of maternal mortality, increased risk of mental health disorders. And about 50% of the women who have abortions have multiple abortions. So there's so many things that just continuing with offering this non-solution as a solution is just raising the risk to women. I am quite optimistic that as approximately half of the states begin to protect women from abortion, that we're going to see the maternal mortality in those states improve. We're going to have a natural experiment in our country where we're going to see the states that are doubling down on abortion, and we're going to be able to compare them to the states that are protecting unborn life. And I think we're going to see that those protections are going to improve the outlook for the mothers as well.
So when it comes to an abortion procedure, I would think the fertility rate obviously will go up as well, because for people who are post-abortive, correct me if I'm wrong, that can affect them in the long run in having future children. Like you've seen thousands and thousands of women, you've delivered over 5,000 babies. Do you have patients who have come to you and have abortion in their past and then have trouble conceiving or have complicated pregnancies from past abortions?
Yeah, I mean, that certainly can happen. I have seen individual women who have had that story. Again, going back to the data deficiencies that we mentioned with maternal mortality, we have the same data deficiencies regarding anything related to abortion in our country. We don't even know the numbers of abortions. The CDC tells us one number. The Guttmacher Institute generally tells us a number that's about 30 to 50% higher than the CDC does. Nobody on the federal level is tracking abortion complications.
And some states don't even report, right?
Right. Yeah. So there is very little desire to get at appropriate and data. And you mentioned one thing earlier. Those European countries, there's good news and bad news about them. They do have much better data, but one of the reasons they have good data is that they pay for abortions. Now, thankfully, our country is not. The Federal Hyde Amendment prohibits payment on a federal level. Believe it or not, though, 17 states do allow their state Medicaid dollars to pay for abortion. So those states are getting rid of their poor children by paying for these abortions. But the thing to emphasize is that part of the reason we had very poor quality data is we don't know all of the abortions that are occurring because women don't want to talk about it. So we can't really look at an insurance database in general. Although at Charlotte Lozier, we have done a number of studies looking at those 17 states, looking at that Medicaid database. And we've documented the same thing that the European countries have, that the women have a lot of complications after abortion that the abortion industry does not tell you about. So, yeah, we definitely need better data. But there are a lot of logistical reasons that the data is often hard to come by.
So what do you think is the answer in maybe shifting this perspective within the medical community? I saw you were a fellow with American College of Obstetricians and Gynecologists. Are you still a fellow with them?
I am still a member. I've been a member for 30 years. And as I mentioned earlier, their leadership are very pro-abortion. So they say things that really are not documented by science. This is an ideology that we see when they say that there should be no restrictions on abortion at any time for any reason. That's ideology. But ACOG has the more significant part of ACOG actually helps doctors. It looks at the literature when it's a non-political issue like hypertension and gives us very good advice. That's why I remain a member of ACOG. But the reality is they have never, in the 30 years that I've been a member, surveyed their membership about our views about abortion. So when they say they represent 60,000 doctors, that is absolutely incorrect. They've never asked us. But as I mentioned earlier, approximately 90% of obstetricians do not do abortions. So I think if they surveyed us, they would actually find something that would not support their ideology. That's probably why they don't ask the question.
So you're not allowed to push back then, or essentially...
They may consider me a bit of a gadfly because I've made no... I'm not hidden the fact that I'm a member of ACOG, but that I disagree with their leadership. But when you look at the real, the good quality data, what you find does not support their assertion that abortion is safe, effective, and evidence-based healthcare.
So would you mind sharing, I know there's obviously patient privacy and you're not going to share any names, but would you mind sharing maybe like one of the most extreme cases where you've tried to save the life of the mother, baby ended up surviving or something along those lines where you just didn't know if it was going to happen? Could you give us any personal stories that you have throughout your decades of experience?
Well, I would say that probably the most common, and there would be a number of stories that I could relay related to those crises that happen right around the time of viability, 21, 22, 23 weeks. I've had the privilege of working in an amazing hospital system in which the neonatologist and the support staff have been amazing. So some of these little babies, really not much bigger than your two hands put together in terms of their length and their size, very, very small, 500 grams. They look like a China doll. They're so fragile. And yet those children delivered in the best way that we know how, giving the best obstetric care that we can, and then handing them to the neonatology team who give them the best care that they can. Many, many of those babies have survived, and many of them have done well. We know that sometimes they survive and there can be some health problems. But surprisingly, some of these incredibly fragile babies, when I see them back in my office as a year-old or a 2-year-old or a 5-year-old, without knowing that story, I would never guess that they had had such a dramatic entrance into life. So we need to give every life the chance. Many times we're surprised that those babies do better than we would even anticipate. But even when they don't, even when they do pass away, we've shown that mother and that family, we are going to do the best for you. That's what medicine is about. That is Hippocratic medicine. Obstetrics has a two-patient paradigm. The mother and the baby are both our patients. We owe them both the best quality medical care that we can give them. And that's what I and most of my peers do strive to do.
So I feel like I need to ask this question because it's one that we get, especially when it comes to the health of the mother. It's one that is probably the most emotional that we get. What about the 13-year-old who maybe has been raped or maybe she just was having unsafe sex? She gets pregnant. or maybe even 12, and it could be an issue for her to carry the pregnancy. How do you deal with something like that as a pro-life OB-GYN? What are the steps that you take to acknowledge both lives and treat them both with dignity?
Well, of course, that is the issue that is extraordinarily rare, but, addressed in the media constantly.
Yes, it
and
makes
I've
the
been
headlines.
attacked for making a factual statement based on CDC data. Even those extremely young teenagers, we know that their maternal mortality is not high. So the reality in terms of the health for that young girl is that she can make it safely through a pregnancy. I've never said whether, what should be done in that situation, but the truth is with appropriate medical care, she can give birth safely. But, I think that really we need to be having a deeper conversation in our country where there's all this outrage that we can't easily maybe coerce her into an abortion. Where's the outrage that is happening in the first place? Where is the outrage that Planned Parenthood is in our schools at a kindergarten level sexualizing our children? Where is the outrage that our families have broken down, that pornography, substance abuse, and just general immorality has diffused our country to the extent that a young girl is not even safe within her own family, that a family member could inflict the violence of rape and incest upon her? Where is the outrage on that? These are being weaponized as excuses to try to overturn all of these laws that are protecting healthy babies and healthy mothers. As we discussed earlier, they don't care so much for that young girl. If they cared, they'd want to stop it from happening. They'd want to stop that pregnancy from happening in the first place. And if that girl, another thing, not every state has a law permitting abortion in this situation, but some do. But all those states ask that abortion be reported to law enforcement and to child protective services. And, we've seen outrage against that. So why do the people who act like they're concerned about this situation, why do they not want that to be reported to law enforcement? Why do they not want that criminal prosecuted? Why do they not want that young girl to be removed from that abusive circumstance? What's going on there? I mean, I think that this, it's clearer that this is just an excuse. This is just an argument to try to overturn these laws and really does not reflect care for that child. And I would say one final thing. If a young girl is pregnant and her pregnancy is not known until later, and someone from the outside says that girl needs an abortion, is anybody asking that young girl what she wants? Think of a situation where perhaps she's already feeling that baby move, okay? Maybe she's in a household where she feels no one loves her. She knows she's pregnant with a child and she has love for that child. Maybe she thinks, maybe this baby will love me because no one else does. To inflict an abortion upon that young girl, in the second half of pregnancy, the CDC tells us that there is 76 times higher mortality, maternal mortality, from an abortion at that gestational age. So forcing her to have an abortion may go against her desires. It may be extremely dangerous for her. Another alternative perhaps might be an open adoption where she could have a relationship with her child. So again, I'm not saying what the answer should be, but I think any of us who profess to care for a girl in that situation need to be willing to have a broader conversation. Why are we not trying to prohibit it? Why are we not willing to have law enforcement and CPS involved when it happens? And why are we not willing to acknowledge that young girl's desires should be taken into account? For her to be forced into an abortion, I mean, as we've discussed with the mental health disorders earlier, that has nothing but the potential to cause trauma to her entire life. She's already had the trauma of the incest and the rape. Are we going to inflict another trauma? Is that how we want to care for this young girl? So I know I didn't really answer your question, but I do want to just say that this is far more complex than just making her unpregnant by offering an abortion and then thinking that that's all that needs to be done for that poor child.
Can you imagine, as you're saying this, I'm sitting here thinking of all of the resources, all of the money, all of the activism that has been dumped into the pro-abortion agenda. Had that been used to prevent sexual assault or to prevent rape or to provide education on this? I mean, think of the hundreds of millions of dollars that have been dumped into pro-abortion narratives across the country. If we had been using that for some of these other things, then these people that they say that they care about because they want them to have an abortion after the fact would have actually prevented the assault altogether, possibly. I mean, I'm not saying that's going to eliminate everything, but my goodness, if we're dumping hundreds of millions of dollars into education and not sexualizing children and doing things the right way, we just prevent it altogether. I mean, you would think that that'd be the best thing, right? Because then she doesn't even have the trauma of the assault or have to worry about an abortion or giving birth at a young age because there was no assault to begin with. So I find it hard to believe that they actually care about these women beyond piggybacking off of their trauma to defend the other 99% of abortion cases. They use that trauma of the rape victim to promote the rest of the abortions that they support because they can't really advocate for it in a way that makes any sense. So they have to use the poor innocent girl because they need that emotional argument. But like you said, if you care, why aren't we addressing all of these other things? We could be preventing these things. And I'll believe that they care about that young girl when they're actively trying to prevent these instances from happening. Sorry, I went on a little rant there, but I'm just thinking
understandable.
No.
Absolutely. That is such a good point. I mean, what we've got to recognize is we've had 50 plus years of widespread abortion and our country's in trouble. We've got mental health conditions rampant in young people these days. We've got STIs and Guttmacher tells us we're now back to above 1 million abortions a year. Why have we not done something to prevent this from happening rather than saying ending human life is our solution to all these societal problems? Let's address the problems. Absolutely. Let's try to get families back on track. And the good news is, as you know, there are organizations addressing these problems. There are 3,000 pregnancy resource centers in our country that not only will give material support and ultrasounds to women who are encountering an unintended pregnancy, but relationship counseling and mental health counseling and material support. And the states that have now put limits on ending unborn human life have a number of resources available. Alternatives to Abortion program, a lot of state financial resources to help women to give birth to their children. So the whole narrative that pro-life people merely want to prevent the abortion and we don't care is absolutely false. And you don't have to look far to see that there are a lot of organizations, just as you said, that want to go to the root of these issues. How do we impact upstream determinants of health so that we can prevent these abortions? We can prevent a woman. The conversation should not be how easy is it to have an abortion. The conversation should be, as even President Clinton acknowledged, why don't we want to say an abortion is a regrettable circumstance in any woman's life? It should be safe. Well, if you want to say safe, legal, and rare, but certainly it should be rare. But let's make it unthinkable. Right. Let's prevent these situations from happening. But if they do happen, let's provide so much support that ending human life is not the choice that is made.
Absolutely. So Dr. Skop, I'd love to have you back on another time, maybe to dive into the actual abortion pill and what that is, maybe even a little bit of the history of it. But before I let you go, I want to ask you really quickly, because I think this is an important thing to address, even though we didn't really dive into the abortion pill today. When it comes to reversing an abortion, I want people to hear, since this is a topic that we're talking about, and we're talking about all these medical instances, and maybe somebody thinks that, they're just prone to have issues, so they need to go take the abortion pill. Is an abortion reversible? We've heard of the abortion pill reversal. We hear people in different states, legislation's trying to crack down on this. In my old state of Colorado, they were trying to punish people for promoting the abortion pill reversal. Have you seen the reversal work? Is it a thing? Is it real? What do you think about it?
Yes, absolutely. I would love to come back and we could talk for hours probably about these abortion drugs. But in a nutshell, anybody who agrees with the science of Narcan to reverse an opioid overdose, which we're told by the CDC, this is a life-threatening or a life-saving intervention. It's exactly the same type of science that supports abortion pill reversal. The first drug, mifepristone, blocks progesterone receptors. It kills the embryo because it cuts off that crucial hormonal support. Many women are coerced. Many women take these pills when they're undecided if that's what they really want to do. And many women regret that action almost immediately. They find access to a doctor who's willing to provide high-dose progesterone. So if mifepristone is blocking the receptor, maybe if we overwhelm the system with progesterone, which is so safe in pregnancy, we use it all the time for many indications, we can dislodge the mifepristone, we can keep those receptors turned on, and we can keep that baby alive. And the data tells us less than a quarter will continue to live without the progesterone. If we give progesterone, we've improved the odds to about 2/3. So it doesn't save every baby, but it saves many babies. 5,000 babies have been born following that intervention. So it works, it's safe, and the only reason that we're seeing so much flack on this procedure is the abortion industry does not want you to know that women are coerced, does not want you to know that women regret their abortions, and they've proven definitively they're not pro-choice because they're actively fighting against a woman having a choice to try to save her baby's life when she changes her mind.
It's such a valid point. A little cool story before I let you go is I do a lot of baby showers for women when I've partnered with some pregnancy centers, and we do fundraisers for these women, baby showers for them. And one of the women that we did a shower for, interestingly, she was pregnant. She took the abortion pill. She found the abortion pill reversal. She decided to call the phone number, get a hold of a doctor. This was actually with Bella Health and Wellness in Colorado, who fought tooth and nail to be able to continue to provide the abortion pill reversal. I'm so proud of them. And they were able to reverse it. And not only did they save the baby, but they saved both babies because she was pregnant with twins. Oh. And I have held both of those babies in my arms after she took the abortion pill, after they were able to reverse it. And they're both two beautiful little twins today. And it just is really cool to see. And it's so disheartening, like you said, that they don't want people to know about the abortion pill reversal, because then they have to admit that there is regret when it comes to abortion. And that is not pro-woman. That is not pro-choice. Like they like to say, because women should have the choice to reverse it if we're actually going off of what she wants. But Dr. Skop, I thank you so much for joining the show. Your expertise is just so appreciated in this movement. And I definitely will be picking your brain again at some point or another. But I appreciate you joining us. Students for Life loves you. And we're looking forward to seeing all that you do with this movement.
Thank you, Christine. It's so good to be with you, and I'm just so happy that you're getting the word out and that your viewers are going to be able to talk to their friends. And we have to explain to the American public that they've been gaslighted and that pro-life is pro-woman, and it's beautiful beside, like you said.
You're so right. Thank you.